Hi, my name is Sara Gasco, and I'm doing my health history assignment, and I'm using Samantha Griffith as my volunteer. So, Samantha, is it okay that I use you as my volunteer?
Yes.
Okay. Hi, my name is Sara Gasco. I'm going to be doing health history on you today. What is your name?
Steve Young,
Nice to meet you, Steve. How old are you?
42 years old,
What's your date of birth?
12/14/72.
Are you married?
Yes.
What's your occupation, sir?
I'm an accountant,
Roughly how many hours do you work per week?
40 hours.
Do you have any history of MRSA or VRE?
No.
Would you like to be a full code?
Yes.
Do you have any known allergies or drug allergies?
No, but sometimes when I mow, I sneeze frequently.
Okay, I'm going to now take your vital signs. I have a temporal vital machine, and you just rub it across the temporal, and his vital sign was 98.7. Then in order to take the pulse, I would use the radial pulse, and you just feel on the wrist, and you count for 30 seconds if it's regular or a minute if it's irregular. And then after that, I would take the respirations, but I would not tell him that I'm taking them, and count those for 30 seconds and times those by 2. Then I would take the blood pressure, and I would put it around the upper arm and have the artery meter meet up with the brachial artery. Then I would palpate for the brachial artery, and I would pump it up until I can no longer feel it. Then I would go up 30 higher than that, and I would then put my stethoscope on the brachial artery and deflate it and listen for the sounds. His blood pressure was 150/90, which is kind of high. And in order to get a pulse ox, I'd have to get a pulse ox meter, but his pulse ox was 97. How much do you weigh?
200 pounds.
What is your current statement of the problem that you're here today?
I'm concerned about what I need to do to prevent another heart attack and develop a healthier lifestyle.
Have you had any signs and symptoms?
I've had chest pain. I've had a previous heart attack. I've been told that I've had mild heart damage, and I also have high cholesterol.
As a child, did you have any childhood illnesses?
I had the chicken pox.
What is your surgical history?
I haven't had any.
Now, your family history, is there any history of heart disease, hypertension, stroke, epilepsy, migraines or headaches, diabetes, asthma, cancer, allergies, anemia, HIV, any mental illnesses or alcoholism?
No.
Is your mother still living?
Yes.
What about your father?
Yes.
Do you have any siblings?
No.
Are you up to date on all your immunizations?
Yes.
Have you had a pneumothorax shot?
No.
What about an influenza?
Yes.
Do you get that yearly?
Yes.
Have you had a tetanus shot?
Yeah.
Have you had that within the past 10 years?
Yes.
Have you had any recent exposures?
No.
Are you currently taking any medications?
I take over-the-counter medications for my migraines.
Have you had any history of abuse?
No.
For Erickson's developmental stage, his stage would be generativity versus stagnation, and I would consider him to be a positive resolution because he is concerned about his life since he is expecting a new child. Do you have any emotional concerns?
Yes, about my stress.
What about spiritual or religious concerns?
No.
What about major life changes?
Yes, because of my health.
Who do you turn to in times of stress?
Myself.
What religion are you?
Catholic.
Who is your clergy, person, or pastor?
Father Hagstrom.
Are there any particular religious practices important to you?
No.
What ethnicity are you, sir?
African American.
Are there any particular cultural practices important to you?
No.
His general appearance is that he looks stressed and he looks tired. He appears to be overweight, but he has good hygiene and he's well nourished and maybe even overnourished. Are you a smoker?
Yes.
How many packs per day?
1.
How long have you been smoking?
15 years.
Have you ever tried to quit?
Yes, I have many times using gum, but it hasn't been effective.
Okay. Do you chew tobacco?
No.
Do you use alcohol?
Yes, 2 to 3 times per week.
Thank you. Have you used any recreational drugs?
No.
Do you use caffeine?
Yes. I drink coffee every day, 2 cups in the morning.
Thank you. Do you have any functional problems such as inability to walk? Are you currently receiving occupational or physical therapy? And have you noticed any inabilities to do self-care?
No.
Is there any changes in nutrition, and are you a regular diet?
No changes in nutrition, and yes, I'm a regular diet.
Have you ever received any tube feedings?
No.
Do you have any difficulty sleeping?
Yes, I experience some insomnia. I go to bed about 10 and wake up frequently during the night.
Do you exercise regularly?
No.
Have you ever used any integrative therapies such as acupuncture, apnea, guided imagery, breathing exercises, heat or cold packs, music, chiropractor or massage, relaxation, hypnosis, or herbs?
No.
Do you have any acute pain?
Yes.
Where is the location of that?
In my chest.
On a scale of 1 to 10, what would you rate it?
A 7.
How often does it last?
It comes and goes.
Is there any aggravating factors that make that pain come?
The stress.
What about what helps it make it go away?
Relaxation.
Do you currently experience any chronic pain?
Yes, I have headaches and migraines.
On a scale of 0 to 10, what would you rate that pain?
An 8.
How often do those last, and how often have you had those?
They last about 2 days, and I've had them since college.
Is there anything that makes those migraines come on?
Stress.
What about that alleviates that pain?
Sleep and my over-the-counter medicines.
I can tell that he has dry skin and a dry scalp. Do you use anything to prevent those?
My over-the-counter dandruff shampoo, and I sometimes use lotion.
Do you currently have any vision impairments?
Yes, I wear glasses, and I have sensitivity to light.
And you experience that in both the left and right eye?
Yes.
Do you have any hearing impairments?
No.
Do you have a history of nosebleeds, decreased sense of smell, frequent colds or nasal congestion, or a history of sinus infection?
No.
Do you have any history of frequent sore throats, cold sores or mouth ulcers, thrush, gingivitis, dental cavities, difficulty chewing, difficulty swallowing, aspiration precautions, missing or any broken teeth, or any partial or upper and lower dentures?
No.
Do you have a history of stroke, headaches, seizures, Parkinson's, dementia, weakness, paralysis, head injury, loss of consciousness, or brain disease?
I've had a stroke and a migraine or headaches.
Do you have any history of mental illness, anxiety, depression, irritability, mood swings, difficulty concentrating, or are you currently suicidal?
No.
Do you have any history of high blood pressure, coronary artery disease, varicose veins, congestive heart failure, peripheral vascular disease, edema, deep vein thrombosis, myocardial infarction, high cholesterol, chest pain, stents, arrhythmia, or an irregular heartbeat, bypass, or a heart murmur?
I have high blood pressure, edema, a myocardial infarction, high cholesterol, and chest pain.
Thank you. Do you have any history of chronic obstructive pulmonary disease, difficulty breathing, orthopnea, emphysema, asthma, inhalers or nebulizer treatments, oxygen, tuberculosis, or do you have a cough?
No.
Do you have any history of diabetes? And if so, do you use an insulin pump? Have you had any history of thyroid disorder, anemia, an enlargement of the thyroid gland, an intolerance to heat or cold, or an excessive thirst or hunger?
No.
Have you had any history of enlarged lymph nodes or lymphoma?
No.
Have you had any history of inflammation of joints known as gout, hepatitis, cirrhosis, liver failure, jaundice, or an accumulation of fluid in peritoneal cavities?
No.
When's the last time you had a bowel movement, sir?
This morning.
Have you had any problems with bowel movements or irregular bowel movements or heartburn?
No.
Do you have any history of frequency of urine or trouble urinating or painful urination?
No.
Do you have any, since you are a male, do you have any history of erectile dysfunction, testicular pain, and do you perform testicular self-exams?
Yes, I perform the self-exam.
Have you had any infertility problems in the past?
No.
Do you notice during those self-exams, have you noticed anything abnormal?
No.
Do you have an enlarged prostate or prostatectomy?
No.
And no sexually transmitted infections?
No.
Musculoskeletal. Have you had any history of decreased range of motion, History of fractures, arthritis, osteoporosis, scoliosis, or kyphosis?
No.
Have you needed the use of a cane, walker, wheelchair, or any prosthetics?
No.
Thank you very much, sir. It was nice meeting you. I will send the doctor in shortly.